It goes without saying that we're very proud of our community. Calloway County has a population of 37,700. Our county seat is Murray, and Calloway County is the home of Murray State University, which is a public university with between 9,000 and 10,000 students. Calloway County is bordered on our east by beautiful Kentucky Lake. It's the largest man-made lake in the eastern United States. Our unemployment rate is low. We're routinely ranked one of the healthiest counties in the state. We have a wonderful health department. Our community owns a hospital and a nursing home with a total of 285 beds, so we're well equipped to meet the health needs of our community. We have received from time to time recognition for various quality of life awards, so we're very proud of our community, and we would like to invite anyone to come visit us at any time. We will try to make you welcome.
We're here to talk about our consortium and some of the efforts that the consortium has put together. And I tell you what, we're really proud. I'm really proud of this group of individuals. I've been here I'm on my 4th year now. I'm starting my 4th year. And what I found after the first year was there's a lot of great programs in this community that take care of people. But it didn't seem like they were connected as well as they possibly could be. So one of the ideas, I brought a few stakeholders together and said, what would be the possibility if we not duplicate programs, and if we could put all our eggs in one basket and have a bunch of power together, develop this synergy between us all, and look at and try to cure some of these community projects and community challenges that we have here dealing with health. And there are a lot of stakeholders all bought in and said, hey, we're going to do that. So when I talk about the stakeholders, it would include not only the hospital and of course the patients we have out there, but it would also include our different wellness centers, our parks and recreation, both the city, both the county, Murray State University, and the power that it has as far as being able to provide research to us, United Way, and I can't leave out our schools, because there are potential plenty of problems we can work on with our schools. And so both Murray City and then the Calloway County schools also participated, and we were talking about some heavy hitters out there with the superintendents come out to support, and the judge executive and the mayor, certainly our Murray State representatives, are able to participate with something that we think is very key, and that is, again, bringing all our forces to bear and do the best we possibly can to allow this consortium to work on key problems. This is probably July of 2012. We got everybody together. Asked Susan Miller, who's a Dr. Miller up at the university, to come over and kind of help chair the project, and then Keena Miller stepped up as well. She's one of my directors for a wellness center. Does an absolutely fantastic job, and those two were able to spearhead this and really come up with a pretty nice project. One of the first things we want to establish, David, was to come up with a mission. What's the mission of this group? What's our vision? What do we think we want to try to do for the future? And that became our driving focus. And at that point, we'll just kind of see where we were. Real quickly, and I would never be able to get this mission directly because I got to read this thing, but it's Murray Calloway Wellness Consortium strives to enhance the quality of life of the citizens of Calloway County by coordinating the services of community organizations and executing a county-wide sustainable strategy that results in long-term tangible impact on health of our community. So it'd take me a long time to memorize that. But really our vision was to maximize the health of the citizens of this county. We thought that was pretty, very simple, very easy, hard to obtain, but certainly something we want to try to do. Before you go on a journey, you always want to look at an opportunity to figure out where you are today. So I'm not sure we knew where we were, but lo and behold, we got our state resources, basically our scorecard, if you will, about the healthy counties. We found out we were 3rd. Well, that was pretty good. We're the 3rd healthiest county in Kentucky. And then I asked the next question. How did we get there? And what did we do to become the 3rd healthiest? And then, oh, by the way, I kind of like to be number 1. Who's number 1 and number 2, which we found out was Oldham County and Boone County. A little different than us, both outstanding counties. Oldham is probably, well, when I did the research, there was the 48th richest county in the country, which is pretty significant with 120,000 population, and compared to Calloway, we're not quite that large, and then Boone County was also not too bad in the affluency, so we tried to say what made them special. We researched that, and then came back, so there's some ideas maybe we can steal from them and put into place here at Calloway, because we want to get better. And then it came down to the big project we've been working on since about December timeframe, and with the help of the health department's been fantastic. Linda Cabot and her crew were able to secure us a grant. That grant was put forth to having a facilitator come down from out of the Appalachia Health Center. I'll get this right here. I'm sure I get that right. Oh, I'm sorry, it's the Kentucky and Appalachia Public Health Training Center. Had a wonderful facilitator that came down, worked with us in December of 2013, after we'd established all our ground rules, to help us develop a community health assessment. And it's that community health assessment that's been really laid the groundwork for us based on our mission, based on our vision, where we wanted to go. And we expanded our stakeholders at that particular meeting. Now at that meeting there were not only the ones I mentioned earlier, but you had individuals from schools, you had behavioral health resources here in the community that were here, you had women's health groups that were advocates, some of our shelters and groups were standing forth for, again, some of the disenfranchised populations we had out here. We had children's representatives, and everybody had their idea of what we needed to do to try to capitalize or make a change. And I try to narrow the focus a little bit by saying, let's not try to go after everything we can go after, because if everything's a priority, nothing's a priority. What big groups can we look at? And our facilitator helped us to determine that there were several really high value targets we can look at. For instance, drug and alcohol abuse within the community. Of course, that's important. A no-brainer for all of us is childhood obesity. I think our children have really, really strong thumbs. They play video games quite well, but we've gotten away from the opportunities for them to kind of get away from eating at McDonald's and some of the other. As we saw, I don't know if you saw the report that has recently come out on the different types of foods out there, but unfortunately McDonald's hamburgers were #1 on the bad list. Not picking on McDonald's, but fast food, it definitely contributes to the obesity. It's easy. I mean, it's certainly, when you're taking kids from one activity to another, they probably may not be getting the food that they necessarily need to have. Not that there are some healthy choices they can make out there, and I'm not defaming our fast food industry. There's just some opportunities they can do, and I'm glad that they can go in now and get your little apple dip and things at McDonald's, so I do appreciate the fact that they are trying to look after everybody's health. And then eating in moderation. Adult obesity, of course, is key. In the Western Kentucky area, 2 key things we've identified. One was cancer. We are very high in prevalence of cancer here. We're #1 in the state, unfortunately, I hate to say. And we're also #1, and in that subcategory, we're #1 of the subcategory of cancer here is breast cancer. So that's something we don't necessarily want to hold the #1 spot on. Right. And we've got to look at ways we can try to make that better. Along with that is cardiovascular. We're also #1 in poor cardiovascular health in the state. And so that's areas that we want to try to go after. But when we boiled it all down, we start looking at those last set of categories, we realized that they were both the categories of obesity for adults and children, as well as your cardiovascular problems, could all be handled a certain way, and that is, maybe we need to change lifestyles. Change lifestyles, starting with our kids, starting in the schools, starting with those good menus, teaching good habits, and work on the parents to set very good examples for their children. And then rather than the video games, maybe getting them enrolled in a little bit more active lifestyle with anything we can offer here in the community. And if you notice, all those things play together, whether it be the state, the city, or the county, coming up with programs that are well integrated, whether it's done at the schools, whether it's parks and recreation, whether it's something that Murray State can offer from an education standpoint, we are going to win all our. And then, again, I get to go back to the schools again and what you put on those menus to kind of help set that example and teach those good things, and maybe health promotion sorts of things that the hospital can do and the health department can do in concert with one another. So that's kind of where we are today, and we've narrowed it down with all that major laundry list down to 3 areas. And those 3 areas, and I'll just touch on those real quickly, or it really was, what outcomes do we have? I said, you have to set goals for yourself. And again, a little lengthy, so I'll read them off, but the obesity work group came up with the following. They want to decrease the proportion of adults who are overweight or obese from the current 29% to 23%, with a target date of December 31st, 2019. And of course, the source is pretty easy because those are the county health rankings that we get. So we didn't want to recreate the wheel. We wanted to use something that could actually be measurable and that we didn't have to rely on somebody else to do the measurements for us. It's already out there and available. The next objective was to decrease the proportion of adults and children who are physically inactive. Once again, playing on the activity, and that want to reduce that from 24 to 20% also in a 5-year period. And last but not least, wanted to increase the proportion of adults and children who have access to exercise opportunities. And right now it's from 52%. We want to raise that 10% up to 62% in the next 5 years. So, I mean, those were the key things that the consortium, this particular obesity work group, wanted to work on and say, okay, these are our long-term goals. Now the next step is put the plans into place to support the objectives that we'd like to see go forward. So we're being very methodical about this and very, I hope it's thought-provoking, but also thought-generating and plan-generating, and we can put these in place, whether it be the city, the county, the schools, Murray State University, Health Department, and us all working in concert together and kind of bring all our forces to bear. As I said, maximizing that synergy to get us where we need to go for our future.
Keena Miller. I'm the Director of Health and Wellness here at Murray Calloway County Hospital. The hospital has a huge commitment to community wellness and improving the health and wellness in the community, and we have some great partners here in Calloway County. And over the years, we've partnered on a lot of different projects, and they usually start off really with a lot of enthusiasm and then kind of die down as we go through it. And so about 2 years ago, our CEO, Jerry Penner, and Dr. Susan Muller and Linda, I believe, all had different conversations, and we're discussing the fact that there was a lot going on in the community, but it didn't seem to be collaborative as much as it could be. And so we got together as a group. We invited of course the health department was involved, the college, Murray State University, the hospital, both the county and city government, both school systems, our parks, our Chamber of Commerce and United Way. And we got together and just talked about the different things that were going on and what our vision was for the community, and then what we would like to see occur. And of course, everybody's going to say that their vision is to have a healthy community. And so after a little bit of discussion, we all decided that we wanted to come together as a group, make that commitment, to work together and develop a strategic plan that could be sustained to improve the health of our community. And so it's taken us 1.5 years to actually get together and working with the health department through a grant that they got for us to sit down and do a community health assessment and then develop a community health improvement plan, which we're in the middle of right now. So the two biggest things that we found in our community, which really isn't a surprise, I think a lot of people find it, is obesity. That's a growing trend across the country, and it impacts so many areas of our lives. And then also substance abuse. And actually, substance abuse came out in several different ways. Not only when you think about substance abuse as being drugs, but we had alcohol in there, we had smoking, we had mental health services. So 4 of our top 5 health concerns dealt with substance abuse in some manner. So those are our 2 big items that we chose to be working on over the next several years. At this point, we're still in the planning stage. We have identified some of our goals, and of course the goals are going to follow what the state plans to do, and that is reducing the obesity rate, to decrease the proportion of adults and children who are physically inactive, and then to make sure that they have access to exercise opportunities. There are already a lot of good things going on in the community. As I mentioned, we have just recently added sidewalks all over the place, which I love. So the community is a lot more connected than it was even a year ago, which adds so much to the exercise opportunities. We have a great parks department, so maybe the consortium can work to help educate the community and set up some type of assistance programs to get people out and moving and educate them on how important that is, because that plays such a big factor in obesity.
There's definitely a focus on that anywhere you, whether you're watching Brian Williams in the evening on NBC News, where you're watching KET, which I watch nonstop almost, whether you're watching Dr. Oz or whether you're watching The Doctors, of which, by the way, the chair of the doctors is a Vanderbilt surgeon, by the way, and you know what his wife is? A pediatrician. So they periodically talk about nutrition. The academy locally has. I'm always getting a blip from the Kentucky chapter on nutrition, and we just keep working at it. And hopefully, sometimes they'll hear us, and sometimes they don't. And so, along with nutrition, of course, is one of my favorite things has to do with choices of foods, as well as quantity and how much you fill your plate, but also children need activity. We're into the middle right now of strawberries and blackberries and blueberries, and I had my first corn on the cob over the weekend. I'm trying to, through this office, do the best we can, which is, my favorite statement in February, March is do you know anybody in your family with a rototiller? And the answer is, if they have a rototiller, they have a garden. So I say make friends with them, and there's never been a family of 4 to have a garden for 4. They always have a garden for 16 or 20 or what have you. And so I have suggested and do suggest if you have free food, and I think that they could get that food. They could prepare the food, they could freeze the food, and as I told some patients in a family of young people this morning, that you could almost pay cash for your freezers and side-by-sides if you have free food, and use it, and that's it. So that's roughly about it. And then I personally have learned from grandchildren and other children that you're not going to make them eat. You'll have these little, what my mother would call skinny kids that come in the office, and they won't eat anything, and they'll be 3 years old, and they're right, they won't. But you can also make sure what they don't eat to a degree. I came along from the 30s when my mother, and 40s rather, when my mother thought that how many rolls of fat I had, and as well as her friends, meant how healthy I was, and that was on biscuits and gravy and all the things that dropped your iron levels in your blood. And as it wasn't until I was at Louisville Children's in the early 60s that I see kids have heart failure because their blood was so low, hemoglobins were so low. So we've doctored that over the years, just like we've doctored teeth over the years. So that's that. And then one lady said that, the Gerber baby, of which I was an example of how many rolls I have, grew up to be the Michelin Man. And so when you think about that, it's a pretty good comparison. So I'm trying to not have kids grow up to be the Michelin Man. And 3 times this morning I've already suggested that blackberries and blueberries, you can get them uptown. They're not, when you pay 80 cents a jar for fruit, for instance, you can buy some blueberries and blackberries, and kids don't need over 5, 6, and you can have those uptown. You don't have to put sugar on them, and that can be snack foods along with apples. So
Very good.
That's what I stress. Try to.
Very good.
Along with playing outside. There's not a 3-year-old or 2-year-old that will not go outside if the door's allowed, if he's allowed to get, or she is allowed to get out the door, even if it's 102 temperature and humidity. Of course, the salt that's in foods and drinks and things like that. So what I try early to do is get them to drink milk and water, and that's about it. And get the fiber that way. They can do that, but we have excellent coverage, I think, here locally. These ladies, our health department has been an exceptional health department since I was a kid growing up. And if you go back through the records, we've got some nifty people, starting with Dr. Allen and coming on up with a guy named R.L. Cooper and what have you, that have made history within the health department system in Kentucky. And we have good support here tax-wise, and we're not, and that's good. So these people have good help. I mean, they have educated help, they have trained help, and we go out and try to get them to eat properly and understand why they eat properly, and that's it. I'm not one to take foods and say, eat this because I told you so, but you fix it in a way that kids like it. And while they like, you know, macaroni and cheese, one lady said, what's wrong with macaroni and trees? Meaning you can get your broccoli and stuff into it, and so it's creative, and there are handouts on that. They've got it handouts, we've got handouts. You harp on it, and hopefully they'll do that. I think there's enough gardens and there's enough families with big gardens that I think if they wanted to go to the trouble to eat out of the garden, they could. I really believe that with all my heart. It's like tomatoes. When tomatoes come in down here, I mean, people are throwing bushels of tomatoes out the window because everybody comes in. And while my grandmother canned them, and she canned sausage, you can freeze all this stuff now. You can put tomatoes in a bag. Watermelon, you can just take them up and slice them, and peaches and stuff like that, and you put them in Ziploc bags just like Swan's does, and you can just pick them out, and if you'll eat them fast, they won't discolor. But anyway, that's that, and so that's it, as well as choices of cereal and oatmeal and bananas, and being sure they get a meal before they get to school.
Tab Brockman, and my title is Park Director, Murray Calloway County Parks and Recreation Department. So the Parks Department runs lots of people through the gauntlet of many different activities over the course of a year. We have over 200,000 visitors to our parks, actually over 213,000 visits to our park during the course of 2013, and we suspect that'll be as big or more in 2014. So whether it's our leagues for our youth, our Murray Calloway County Soccer Association has over 600 kids who play soccer here, or whether it's our Murray Youth Baseball Softball Association, which has over 750 kids playing diamond sports, we offer an outlet for our youth of the community to exercise and stay fit. Well, we've got over 3 miles of walking trails in our park, and those are heavily used. And matter of fact, one of the nice things that we've had a recent addition to our park at the Bee Creek Park is 1.25 miles of walking trails. That was made possible through a sidewalk grant that our community received, and we had some extra money for that. So about 1.25 miles of new paved 8-foot wide pathways, walkways, multi-use trail, which is already getting a lot of action from walkers, from joggers, from bikers, from folks walking their dog, and just the community in general. Trails are a great way to help the overall fitness of our community, and we see moms every day. We've got a lovely, on one of our other trails in Chestnut Park, we've got a Born Learning Trail, which is really neat, with the Born Learning Academy. That is a statewide initiative in part with Toyota, and there are actually little activity stops along the way on that trail, and we have mothers on their Mother's Day outs walking the kids who stop and do all those activities as well. So it's family friendly for sure. And one other nice thing, you all probably are aware, Murray has been designated as a playful city for 7 years in a row. There are only a handful of communities in the country who have earned that designation 7 years in a row. It's a great pride factor, and of course our parks for Murray and Calloway County have played a role in that, but that's a community-wide initiative as well. We have the very first disc golf course in West Kentucky, and there's almost 10,000 rounds of disc golf played on our disc golf course. That's another family-friendly activity. A lot of walking, you go through the trails, and one of those games and activities that anybody can learn to play. The parks were really happy to play a role in the Fit Foods program. Last year we started that, and we kept the program going this year. 20 to 25% of our overall gross food sales fell in that fit food category. Whether it was trail mix, whether it was fruit, whether it was water, Gatorade, turkey dogs. We put an emphasis last year with the assist and help from the Calloway County Health Department to really put an emphasis on fit foods, and the community and the kids really took a liking to it.
My name is Amy Ferguson. I want to talk to you today about some of the things that I have been involved in with the Calloway County Health Department as part of our Wellness Consortium and our Healthy Initiative for the community. The Health Department has been involved with the Trail of Treats. It's held every Halloween, October 31st, at the park, and it's a trail of treats where various organizations are set up inside the park along the paved trail, and a lot of organizations hand out candy and various things, but as the health department, we felt like we wanted to offer healthier options just to promote more nutrition and show that we support nutrition initiatives in our county. So we have made the decision for the past 3 years to offer things other than candy. So the first year we had a theme called Farm to School because we were involved with a Farm to School grant that year, and we provided apples from a local orchard and along with recipes to use apples, and we dressed up in a farm to theme costumes. We had a food service worker, we had a person dressed up as an apple, we had a farmer, and then our theme was all involved around farm props. The second year we did the 5210 message because that was very popular that year, and 5210 is a health initiative to help reduce overweight and obesity among young children. So we promoted the 5210, which is get 5 fruits and vegetables per day, limit your screen time to 2 hours or less per day, get 1 hour of physical activity per day, and drink 0 sugary beverages. And so we dressed up, and we had someone dressed up as a milk carton. We had a person dressed up as a bee to be physically active. We had a person dressed up as a television screen, and our theme was, all involved around the 5210 message. And we provided stickers and water bottles, and again, no candy, but just provided nutritious health information. And then this past year, we dressed up in the My Plate theme for the Trail of Treats. And My Plate is the healthy initiative that promotes healthy eating and emphasizes a balance between all of the food groups and also getting physical activity. So we passed out water bottles. We danced the entire time to Let's Move It, Move It. And we had a wonderful time, and we were dressed up as fruits and vegetables, a fork and a spoon, and a peanut butter sandwich, and we had a big time. And so we were able to reach literally thousands of not only children but adults with our Trail of Treats involvement for the past 3 years.
Linda Cabot. I'm the Public Health Director for Calloway County Health Department. Several community partners came together and they convened as the Murray-Calloway Wellness Consortium. Well, the Murray-Calloway County Hospital was really instrumental in getting the consortium started. We have folks there from city government, county government, the park system. We have people there from, of course, the health department, don't leave us out. We have people there from Medicaid managed care. We have people from the business community. There were some folks from our Four Rivers Behavioral Center. So we tried to mesh, and also from the faith community. So we tried to mesh as many folks together as we could and bring everybody together. We started to look at the health of Calloway County, and we wanted to know what the problems were. So we talked about obesity as a problem and not enough physical activity because we had seen our rankings through Robert Wood Johnson and University of Wisconsin. And so we knew that those were some issues that we needed to work on. And we decided that, first of all, we needed to do a community assessment. So we held forums around the community. When we got the information together, we took a look, and of course we came up with the same information that Robert Wood Johnson did, that obesity was the #1 concern for citizens in Callaway County. That's what they said, that they felt that they wanted us to take a look at and work on. Without all of the partners in Callaway County, we couldn't do all of the activities that we do. And I think with Callaway, whether it's the Wellness Consortium or whatever partnership that we're trying to bring together, whatever activities that we're trying to do, you'll find that in Murray and in Callaway County, we always have a group of people to call upon. And one important partner that I left out earlier, the school systems. We have wonderful school systems. We have the Callaway County District, we have Murray Independent Schools, and of course we have Murray State University that has about 10,000 students. So we have a great group to pull from, and everybody has different resources that they're able to bring to the table. The community came out in full force for our community assessment. We actually received 1,600 plus assessments or surveys when we surveyed the community, and I think that was more than the state actually received. So we were very proud of that fact that so many people came in and wanted to have a part in what the community was going to do and what they wanted to focus on. Well, we plan to work on the Kentucky Health Now initiative, and one of the goals that we have is, of course, for 2019, is to decrease the number of Kentuckians that are obese by 10%. So that's a goal for Kentucky, and that's a goal for Callaway County. We know that 29% of adults in Callaway County are obese. We know that 24% don't get enough physical activity. We know that childhood obesity is a problem in the United States. It's a problem in Kentucky, and it's a problem right here at home. So we know we need to work on all those things, and we want to come together with the consortium and try to take a look at different things that we can do. We know that it's not only about the food that we eat, but it's also about physical activity. But you also have to keep in mind the social, emotional well-being of the person, and also the physical environment. So we want to take everything into consideration and provide a resource list, let the community be more aware of what's going on, and we're confident that we're going to be able to change lives in Callaway County.